thank you, Shafi, for inviting me today. I'm really happy to have the opportunity to share my passion in front of this audience. Let's see if the beep works. Yes. So a cancer journey is a huge emotional roller coaster. Anxiety starts before the first diagnostic procedure and will pile up day after day and week after week, mainly at key moments of the treatment. We're talking about the start of radiotherapy, the start of chemotherapy, but also every time there is an invasive procedure or a surgery. And you don't need to be a cancer patient to know that every time something will be inserted into your body, like a medical device, a scalpel, or even a very small needle, we are freaking out. So when you think about anxiety, we think most of the time about emotional comfort and mental health. Actually, anxiety is much more than this, because the latest studies have shown that anxiety impacts not only the patient's psychology, but also the patient's physiology. Just imagine when you feel anxious, your heart rhythm change, you don't have salivation, reflex normal. Patient's biology will also be influenced by anxiety. Anxiety influences the immune and the inflammatory system, for example. And in the last decades, research has shown that anxiety impacts also cancer biology. It impacts the tumor growth and also the dissemination of tumor cells, which is the main cause of mortality in cancer. The major issue here is that anxiety triggers pain, and pain triggers anxiety. Anxious patients, and for the ones among you who are doctors or nurses, anxious patients feel more pain. Anxious patients need more medication, more pain medication, more anxiety medication, and also more sedation medication during surgeries, which brings additional side effects. So I'm a mental health professional. I'm specialized in clinical hypnosis. I don't know if any of you knows about clinical hypnosis. Maybe you can raise your hand if you know about it. Okay, not so bad. Thank you. I'm specialized in clinical hypnosis. I used to work in the biggest cancer center in the world. It's based in Texas, MD Anderson Cancer Center. And my job was to help patients going through procedures and surgeries with as few medication as possible. So you see me there sitting in the operating room with the patients, delivering clinical hypnosis sessions to patients during the surgery. Clinical hypnosis is a mind-body technique which has been validated for decades as an efficient and safe way to reduce anxiety and pain during surgeries and procedures. Clinical hypnosis creates a modified state of consciousness that has been objectivated by brain imagery. So while working in the operating room with hundreds of patients, I could see how powerful clinical hypnosis is and how empowering for patients it is, but also how challenging it is to have access to it. Why? Because as a mental health or health professional, if you want to use this technique in the operating room, you need to be trained. It takes at least 12 days of training. You need to practice like in any other skill. You need to be available for this patient. And sometimes you get to the patient, you have all these three together in a line, in a row, and the patient does not speak your language. So I wanted to find a way to make this amazing technique, clinical hypnosis, available to the largest number of patients. And this is why several years ago I created Oncomfort. And Oncomfort is the leading company in digital sedation. We deliver standardized clinical hypnosis sessions together with additional psychological interventions, which has been validated by extensive medical literature through virtual reality. Our system and our product is called the SEDA Kit, and it contains all that is needed to launch a virtual reality, a digital sedation session. The hardware and the software that we call modules, or 7 different modules, we have 7 so far, are medical devices. They are certified, CE marked. So our SEDA Kit, we wanted to make this solution available to the largest number of patients, as I said. So we made it affordable, we make it accessible, and we position the price accordingly. It's very easy to use, it's portable, so you can use it easily from room to room, from one operating room to a procedure room, evidence-based, and it really empowers patients. It only requires 30 minutes training from medical team members. They get a certification. We have so far 7 different modules adapted to the age of the patient, to the clinical situation, and last but not least, they are multilingual. We have so far 8 different languages. So I don't know if you can imagine patients who doesn't speak the language of the country they live in. They go into the operating room and they got the virtual experience with the voice in their own language. So just to let you imagine how this works, when the patient gets into the operating room, the surgeon or the anesthesiologist or the nurse will put on the patient's face a virtual reality headset, on the patient ears headphones, and then they will start the session. The patient will dive into a 360 very quiet environment, and they will be guided by a voice which will guide them through the experience. The patients disconnect from the reality, and they get a modified perception of what's happening in the body. They're not aware anymore of what's happening in the room. And during the surgery, they learn technique that they can reuse afterwards to self-manage anxiety and pain. And at the end of the procedure, they're awake, they're fresh, they're really comfortable, and they're extremely satisfied, and no side effects. So we created this solution for cancer patients, but we are approached by a large number of different doctors from a large range of specialties. We are approached by orthopedists, cardiologists, pediatricians, ICU doctors, palliative care doctors who say we don't have any medical, pharmacological solution for patients, because in palliative care they have very high dosages. We created this solution for patients to be used during their surgery and procedure, and we extended the scope of the use of our solution for patients to prepare them before surgery and also to help them manage symptoms such as pain, anxiety, and other issues after the surgery. So I would like to share with you some images about the work doctors do with our solution, which is they're really doing an amazing work, and we are now present in about more than 70 hospitals in more than 5 countries. So I'm happy to share with you some images about, is this working? I need a tech team. It's working? Okay, perfect. So here you see protocol placement for cancer patients. So we didn't have the last version of the SEDA kits. Now we have much more protection. I mean, how do you say? We put caps and disposable protections. This was the first version. So protocol placement. The patient's very comfortable on a local anesthesia, and the doctor can use very focused. Here you see a 10 years old pediatric cancer patient who has needle phobias, and he needs to have a blood draw almost every 2 weeks. And you see here that he's very calm. Breast biopsies, a very good indication too for a system. Here's in Institut Curie in Paris, where what I like here, they use our solution not only on patients, this is a breast surgery, but also they use it for medical doctors and nurses who work in very emotional settings such as ICU, pediatric care, palliative care, end-of-life with end-of-life patients. So surgeons also use it between surgeries. This is a hospital where they started using it in the pathway of chronic pain care, and we can see really the anxiety dropping and the pain dropping in these patients. Burn patients really enjoy the experience. We know that most of the patients, a lot of patients need to be sedated to have burn bandages. It's very painful. And so you see there they have a gas mask that they use in combination with our solution, and they don't need sedation. They just have a very low dosages of gas. So as the previous speaker, one of the previous speakers said, you're not digital therapeutics if you don't have any very strong evidence. And this is really needed for us. So far, we have more than 1,600 patients enrolled in clinical trials. And I would like to share with you some key highlights of the main trials we're working on. First, in Brussels, UCL, which is a big academic center, We have a major study, 450 patients, breast surgery patients, and they have a they have a digital sedation session before the breast surgery. What we can see that compared to the group who did not have digital sedation, the group who had the intervention, 15-minute session in the room before going to the operating room, the pain was reduced by about 50%, so was the anxiety post-operative. Also, the time in the recovery room was reduced by 30%, and the total stay at the hospital also by 30%. The reduction of painkillers in the 3 days after the surgery was reduced by about 80%, which is huge. In the same study, and 72 this time, we see that the patient's anxiety decreased not only on day 1 after surgery, but also up to day 8, which is huge. And we start seeing some interesting inflammatory markers decreasing in the group that had the intervention, the digital sedation. What we see is a really strong decrease also in post-operative pain. We use it also, our system, before oocyte punctures for women undergoing in vitro fecundation procedures. So just before the oocyte punctures, they have a 15-minute digital sedation session. In this study, very interesting, because Denise was talking about distraction. We have one group having virtual digital sedation, so or solution, one group having a sham, so just virtual reality as a distraction, and one group standard of care, so nothing happening. What we see is a strong reduction of anxiety in the two groups with virtual reality, but in the digital sedation group, we also see a significant increase in pregnancy rates, biological pregnancy rates. This is my preferred study. It's urological surgery, prostate cancer surgery in Korea. We had two groups. One group having the sedation during the surgery with midazolam, the other group having the sedation with digital sedation. What we see is that the sedation is more adequate with digital sedation, and there's a strong reduction in the operating risk. So less respiratory issues and less involuntary movements. And for the gentleman in the room, I just let you imagine how badly you don't want to move during urological prostate surgery. So the patients here were extremely satisfied, so were the anesthesiologists, and also there was the time of the procedure was exactly the same for the two groups, which is really very positive. I see time is passing by, so I will skip this one maybe. Just for kids, what we see is that when we use a system during procedure, patients are more comfortable, but so are the medical teams, because they can work more calmly and be more focused. And there's no more need for contention for the kids. I don't know if there's anyone in the room here working for kids. When you have to do contention on them, it's really a trauma for everyone. So today we help more than 8,000 patients. When I first talked to doctors, it was more than 3 years ago, he looked at me, and I presented this project, and he looked at me, and I could see in his eyes that he was thinking, this woman is kind of really weird. And now, 3 years later, thanks to the evolution of mentalities and thanks to the recognition of work it's receiving at international level, digital sedation is really becoming a standard of care in major academic centers. So our goal is not to help thousands of patients. Our goal is to treat millions of patients in the coming years, and we will get there. Thank you very much for your attention.